I'm here with Dr. Gregory Dorn, President and CEO of First DataBank. Hello.
Hello.
Dr. Gregory, what are you discussing this year at the World Healthcare Congress Middle East?
We've been here talking about clinical decision support, so the opportunity to influence clinical decisions that doctors, nurses, and pharmacists are making for patients in hospitals. So that's been our main focus.
And why is an event like this so important?
You know, there's probably a couple of reasons why we come to an event like this. One is we need to meet our current customers. They're here. There are partners here also that we work with, and also obviously there are potentially new customers. We also want to get our message out. We want to educate the audience about the opportunity to improve the quality of care that patients receive, and the fact that we can make decisions, I think, a bit safer for patients in hospitals and medical groups.
What are some of the challenges your organization is facing in the healthcare industry?
You know, I think particularly in this market, one is we require the deployment of electronic medical record systems and pharmacy systems for our decision support to help change practice and how decisions are made by pharmacists, and that's a challenge, so we look for those systems to be implemented. The other thing is that we have to localize or make the decision support that's used by pharmacists and nurses and physicians in hospitals and medical groups and pharmacies, localize it to what the regional preferences are. So there are different medications here than there are in the UK and the US, different availabilities of technology, so we have to customize all of our decision support to be locally relevant, and that's another challenge we have.
So this is what's unique about integrating your systems in the Middle East. How big how big of an issue is medication error?
Yeah, medication errors are a very big global issue. Global issue. They're one of the #1 causes of morbidity and in-hospital complications and morbidity. So if you think about just going into a hospital and getting treated, there's a range of opportunities there that a clinician can make a mistake, and there are a lot of studies that show that the numbers of medication errors have a significant impact on how they do in the hospital. And we know here in the GCC countries that there's a very high frequency of prescribing. So many patients get lots of medications, and we know that there are lots of interactions, but none of those are being looked at or being optimized right now. So we think there's a huge opportunity to reduce the complications that are secondary to heavy prescription rates in the region.
How can these complications be reduced?
Well, the main way is, if I'm a clinician and I'm seeing you perhaps in the medical group or in the hospital, and I make a decision to prescribe a medication for you, you might have a particular diagnosis. At that point that I'm prescribing that medication, I can rely on my knowledge, my education, and my training to help make that choice, or I can rely on that plus an integrated decision support system that will tell me, that'll guide me, that'll say, you might be thinking for Shadia you should give a beta blocker, but because of this database we have, I might give you a slightly different medication, right, that I wouldn't have thought of without that decision support. So that's how we think we can really make a difference.
Mm-hmm. What are some of the innovations your organization brings to healthcare?
Well, I think it's really thinking of, when we think about innovation, we think about how can we change the process of care. So are there ways that we can provide better queuing, or better sort of introducing messages into the practice of the clinician, so alerting, dose changes. So there's a range of different ways that we can do that type of innovation. So we're working on that now.
What do you hope to learn or teach from such an event?
Well, what we've learned so far is the opportunity here is significant to make a difference for patients in the GCC countries, and we're excited about that. We also want people to understand that the types of best practices that have been deployed around the world can be brought here and can be implemented here. So there's a portability to best practices that can benefit all of the populations of the GCC countries.
We were speaking to other guests as well, and they were saying that best practices are fantastic, but they often don't work because they need to be customized and whatnot. Do you agree?
Yeah, I agree. I think there are local population nuances here. There are different disease prevalences that you have to customize your best practices. So if you say, I'm bringing in a panoply of best practices, there may be some that are not relevant here because the same diseases aren't prevalent. Also, there may be differences in what is available technologically to treat patients. So if I have a best practice that says use a particular medication or use a particular technology, that best practice is not very helpful if that medication or technology is not available in the venue where I bring that best practice into.
Dr. Gregory Dorn, thank you very much.
Thanks.
It was a pleasure speaking with you, and we hope you enjoy the rest of the conference.
Thank you, Shadia.
Thank you.